And despite the threat to implement no work, no pay policy by the federal government, major activities across most hospitals in the country were grounded today as members of the Nigerian Association of Resident Doctors downed tools. A tour around the National Hospital Abuja shows full compliance with the strike, making patients' waiting time increase by more than 50%. But management of the hospital mobilized other medical staff to help cushion the effect of the strike on patients seeking medical attention. Health correspondent Kemi Balogun reports.
Out of the 5-day warning strike by resident doctors, activities here at the National Hospital appear normal at first glance, but a closer look tells a different story. Patients at the center of it all are at the receiving end of longer queues and longer waiting time. Pascal is one out of those who had no idea there was a strike in play when he got into the premises.
I was shocked when I went into the emergency accident whatever department, and shockingly the place was jammed, locked, and it's sudden, because if somebody has an accident suddenly and then rushes this place probably to save a life, what happens?
We're told that we can't get any doctor, that the doctor around have seen enough, that we should go and come back another day. They wanted to take only 30 persons.
The hospital management admits there is a gap created due to the strike, but it has been proactive and set up measures to ensure that services continue for patients. And it is urging for a quick resolution to the demands of the doctors.
We might likely discharge some patients, because of the resident doctors' strike. But not that we will not accept patients, in terms of emergency, but we definitely reduce the rate of admission.
The Nigerian Association of Resident Doctors had issued a 2-week ultimatum to the government to meet its demands before it resolved to down tools for the next 5 days.
We've had situations where residents have collapsed at the emergency unit because they were stressed, because they were on calls. And the management of hospital, National Hospital per se, have tried to reach out to government that they need to replace people that have left.
Some other issues they want resolved are a 200% increase in the consolidated medical salary structure of the current gross salary for doctors, an immediate suspension of a bill seeking to ban doctors from migrating until after 5 years of practice, and also an implementation of the commerce payment structure by states yet to do so. Within the last 10 years, resident doctors have down-tooled more than 150 times, including during the pandemic. Now, these strikes continue to take a toll on the effective service delivery for patients. Kemi Balogun, TVC News, Abuja.